Hello, this is Aaron Price, the CEO of TechUnited New Jersey, back for another Ask Member Anything. Today, very excited to welcome to the show Angelo Stracotanio, whose name I hope I didn't butcher, the founder and CEO of Apprentice.io. Angelo, thanks for joining us. Nice to see you.
You're very welcome, Aaron. It's been a pretty short while since February when I saw you last, but my gosh, has a lot happened.
I know. It feels like a world away when we could, when that happened and when we were able to actually get together for an intimate dinner.
Yeah, we were blissfully unaware what was about to happen.
Blissfully being a key word there, yeah, for sure. So tell people, first of all, where are you physically based right now? I'm in Hoboken. Where are you?
So I'm out in the burbs. I'm in Warren, New Jersey.
Nice.
So a little bit west of you, but we have been back in the office, which is pretty exciting, I have to say. We do it about 3 to 4 days a week, depending on density. You know, we do it safe. But today is our work from home day. So I'm a little bit further away from you in the burbs over in Warren.
And where is the office?
In Jersey City. So next door to you, down
right over there. Right. Yeah, that's great. So tell people who may not be aware. And by the way, you know, we're streaming this on a variety of social media. So wherever you are, if you have any questions as we go, drop it in the comments and I'll try to weave it in as we go. But tell people, what is Apprentice.io?
So we built a software platform for a very specific market that for this year in 2020 is a pretty important one, you know, unbeknownst to us, which is we built out an intelligent software platform specifically for life science manufacturing. So, you know, your really big pharma companies, biotechs, you know, as they're trying to increase their speed to market, we built this pre-pandemic, but increase their speed to market, this is an entire tool that truly transformed their operations. Because for those of you that don't know much about life sciences or pharma in general, you know, some of the most important drugs that are for mankind, truly, and I'm not even, you know, overhyping that one, are made with paper. You know, the paper is the backbone of these processes because the sheer complexity, regulatory compliance, a really difficult process to actually make drugs. And so we built out a platform.
What do you mean by that? Do you mean the filing burden, or, you know, what do you mean by made with paper?
The actual manufacturing. So the actual manufacturing process, which really is something that I think a lot of people don't know much about, and especially during COVID. You know, it's kind of like once there's an approval, everyone thinks they can go on Amazon and hit the buy button the next day. You know, it's a little bit more complicated than that. And so the actual manufacturing process, the moment in which let's use COVID, for example, the COVID vaccine is being made, you know, that vaccine is actually grown, and it's grown over time. And that time, you know, can be upwards of several months, depending on the type of batch that is being produced. And so the whole process that they're going through and everything that they're documenting, all the data that they're capturing and everything that the human is responsible for, right now, they're doing all of that with paper. And so, you know, some systems do exist, but generally speaking, you know, paper is this kind of backbone technology in this space. And it's one that, you know, we are completely transforming such that then we believe we can increase the speed to market for really important drugs, that we can increase the amount that they can produce per batch to hopefully lower the cost of drugs, and then decrease the amount of mistakes to increase the safety of that drug, you know, for the patients around the world. Because, you know, when people are following paper, you know, as you can imagine, it's prone to a lot of different errors, a lot of different problems, and we're transforming all of that for what in 2020 has now become an unbelievably important industry to mankind.
So I just want to make sure I follow the pain point here. Mm-hmm. You're saying that there's somebody in a lab at, I don't know, I don't want to point to J&J, but just as an example, right, who is running a bunch of tests and physically writing down on paper the results of these tests, and then hand delivering them to the next person, where maybe they can or can't read the what they wrote, and maybe they can't, you know, maybe it is or isn't in the hands of the right person, and it's impossible to scale, sort of thing. I just want to make sure when we talk about paper process, that's what you mean, right?
So even more than that. So the way that these manufacturing sites are set up, and if it's frankly very hard to visualize this, right, if you're not in the industry. So if you go to our website at apprentice.io, the homepage video, you don't even have to watch it, just the kind of moving video in the background. You can see these people that are wearing these head-to-toe gowns, that they look like these hazmat suits, and they have, safety glasses, masks, whole hooded things on, and they're working in these very complex rooms that you'll see if you just go to our homepage video. And that whole process, or that room, first off, is called a suite, but there's a whole team. So it's not just one scientist doing one job or doing one test. It's a whole team of people, right, that are working together, that are not just writing things down. That is a big problem in and of itself, data integrity and what is this value and did we get it right? But it's following the process. These procedures are several thousand pages long, right, across an entire campaign, and they're all written in Microsoft Word, right? So you can imagine that it's not just about what to do in this space, but how to do it. The technique associated with all of it is unbelievably important. Let's use a cooking analogy, right? It's not just knowing what to cook, but using the right technique on how to do it is unbelievably critical. And when you're reading that off of a 1,000-page binder that is stacks and stacks and reams of paper, there's a lot of, unfortunately, prone to error because, humans are humans. And then forget all of the actual data components where, paper doesn't talk back to you, right? So if the value is wrong, it doesn't talk back to you and say, hey, Angelo, like that doesn't look right, and you need to do something in order to make sure that that batch survives. But there's a pretty massive pain point on not just the execution, which is what we're talking about, but then how do you really optimize this? Because to query right now, they go to a filing cabinet, take out a paper out of a filing cabinet, take out the record of what happened in the last run, type it into Microsoft Excel, and then that's how you build out these models. And so, you could imagine that this whole process, which is very antiquated, can lead to some big challenges. And if you want to really, truly increase your speed to market for, the most important drugs that exist today, you really need a digital solution to really help get you there. And we are the backbone software now that's helping these folks get there.
It's totally bananas the way that you describe what actually happens, but I'm glad you're here. So, I mean, if I were to oversimplify, and perhaps this is an oversimplification, but for people in the software tech world, if they think of this as a very custom build Asana or Trello type tool specifically for this use case, is that a decent analogy?
Yeah, that's a pretty decent analogy. And the one way where we go further is we use more than just a web application, because, you and I sit behind computer screens all day, right? We sit at desks to do our work, but these are deskless workers. So we use augmented reality headsets. We use a number of different mobile tools, and we layer in augmented reality to explain not just that what to do, but how to do it. So coming back to that cooking example, we use with AR a lot of ways to demonstrate exactly how they need to go about working on a piece of equipment, setting something up, performing a test, doing what they need to do. But yes, it's organized as easy as an Asana or Trello or something like that, because we really consumerized this whole world that was used to, very heavy enterprise, like pretty rough type of tech.
Yeah, it's fascinating. I mean, let's talk about how you got here.
Sure.
What was the inspiration? What were you doing before this that gave you the inspiration for this idea?
Yeah, so I actually don't come from life sciences. I didn't spend 20 years making drugs. I didn't, spend my life in this world. And I actually think that's why we've been successful, is because I've approached it from the perspective of tech and how emerging tech in particular, AR, AI, ML, CV, how we can leverage these components, not just for the sake of tech, but how we can actually leverage these components to really transform their operations. And so where this genesis came from was I was having a conversation with one of my other co-founders, who coincidentally is my wife. She's not full-time with us. She runs biomanufacturing at a big pharma company. I can't say who, and I can't say what they're working on, but I can say it's a very important drug for 2020. But I was having a conversation with her, and I couldn't believe that what to me was one of the most sophisticated facilities on planet Earth, that they were still using paper to manufacture these very, very important drugs. And at the time, pre-2020, it was, very important cancer drug. And that they were having all these things that were going wrong at work. They were losing batches. They were having people make mistakes. They were really having some super big difficulties because the technology that they were using was so unbelievably antiquated. And so that created my background. I'm a mobile engineer. So I've been building enterprise mobile apps since the very first iPhone and Android. And to me, it was right around when Google Glass was coming out. And I don't know if you remember Google Glass, but
I do. Oh yeah,
headsets that a bunch of dudes in Brooklyn were running around to the bars with. I saw something in that. I saw something, and I really believe that it represented the next wave of mobility. So not just augmented reality or something on your face, but that it could really transform how people in this environment, in particular, that have to work with their two hands, that have to be involved in different, very complex processes, but they're not in front of a desk, right? They are mobile, they are deskless.
Yeah.
I really believe that concept of a headset really represented the next wave of mobility. And so we ended up building towards that solution. And when we launched in 2015, so over 5 years ago now, we've turned out it wasn't just my wife that had these problems, but the entire industry that had these issues. But at the time, unfortunately, Google Glass was not the right hardware device for our use cases. And so we spent the next couple of years waiting for the hardware to catch up to my software. And it was a long road, a long journey. But finally in 2017, we turned the corner. We raised our first round of financing, and now, here we are 3 years later, and it's been a remarkable journey in terms of our growth story, to where we are today.
Yeah. I mean, we're going to talk a little bit about that story, but I want to make sure that we close the loop on it. There was one pending question that I forgot to get to, which is besides the obvious inefficiencies of paper, how else does Apprentice help? Is it just speed? Are there other efficiencies? I'm picturing like the Gantt chart and the dependencies. Like obviously right now in a pandemic, like can using a tool like Apprentice or Apprentice specifically help decrease the cost, increase the speed to market on some of these drugs?
And that's why we built it. So that's where I come back to this concept of emerging tech, right? Where we didn't just use tech for the sake of tech. We didn't just slam on a headset on someone's face and say, hey man, you now can use augmented reality to solve your problems. Our number one goal and what we're trying to do is three things: increase your speed to market for the most important drugs out there. 2, increase the yield per batch so that the single, and this is actually a quick important side note. When people think of manufacturing, sometimes they think of like Tesla, right? They think of like some guys or girls on a manufacturing line stamping out a door and putting it on a Model 3, right? And in our world, it's very, very different. In our world, drugs are grown, and they're grown over time. Biologics in particular start from actual living cells, and those living cells multiply, and they express then a protein, and that protein then becomes a drug that then is injected into a human being to then fight back, and ward off some type of disease. And that process is classified as batch-based manufacturing. The best analogy is like beer making, right? They have these big tanks and they're fermenting beer, and you eventually get a nice IPA at the end. But in our world, it's pretty similar to that. Drugs are grown and they're fermented in big bioreactors, and those bioreactors then get harvested, and that then eventually turns into a drug. And so when you're dealing with something that's grown, when you're dealing with biology is messy, right? And it's not very easy to control, and it's very complex when it comes to how you manage it and how you interact with it. And so for us, the yield that batch produces is unbelievably important, right? Because of the time component. You can't just add on more robots, right?
Yeah.
Like, you can't just add on more robots. And so for us to squeeze more out of that same batch means ultimately more drug product can be produced, and we believe potentially reduce even the cost of drugs, because the company is actually able to squeeze out more from what they're trying to do. And then the last piece of it, what we're trying to do is increase just overall safety and error reduction so that batches aren't lost, which happens all the time due to a human making a mistake. And that leads to drug shortages, actual drug shortages, when people make mistakes in this world, do something wrong or anything like that. And so this combination, increasing their speed to market, improving the yield per batch, and then decreasing the number of deviations and mistakes, that is truly a transformational line item for these companies, because you're dealing with dollar amounts that are massive. We're not talking like, a $10,000 car or $30,000 car. This is tens of millions, and now for COVID, billions in terms of scale, that, when you multiply that out, it's a really high impact on these organizations.
Yeah, it's really fascinating. Let's talk about the pandemic effect on the business, right? It seems like of all the businesses I've heard of and spoken to, yours might be the most uniquely qualified to have really accelerated under the pandemic. It seems like that's exactly what's happened.
It's exactly what's happened. And this is one of those things where, as an entrepreneur, yes, I am very, very excited about this. And my gosh, the growth is unbelievable. Unfortunate that it took a pandemic to accelerate our company as fast as it did. But I like to at least think that we're on the right side of history with this one, because we are helping our customers try to accelerate a vaccine or therapeutic to market, which, really is for humanity, really desperately needed right now, not just from a health perspective, but from an economic well-being. I mean, you name it. The faster we get out of this thing, the faster that, humans can go back to doing what they're good at, and building a society that we want to see. And so, prior to 2020, we've been working this for a while, right? It's been 6 years since our inception, 5 years since we launched. That's a fair amount of time that we've been in this. And we've always known that these core tenets, increasing speed to market, improving yield per batch, and decreasing mistakes, we knew that this was going to be important. It's just that we didn't expect COVID to accelerate and compress everything as fast as it did for us. And so just some crazy statistics to throw out there. Since January, and again, we've had 5 years of built up growth and usage and everything. Since January, our usage went up 18 times. The number of deployments we did went up. Now we're past 10 at the end of Q3, and we're coming up on 11x since January. Again, 5 years of built up growth has gone up over 11x since January. We had our revenue shoot through the roof, obviously, but we've also just had the impact of what we're doing really be something that has been remarkable, where, it's not just about COVID. It's not just about COVID. I don't know if you remember early in the pandemic, there were a lot of articles about, man, the global drug supply chain here could really be disrupted.
Absolutely.
There could be a severe moment in which, it's not just COVID drugs can't be produced, but other ones can't be as well. And we were right in the center of that, where we had one of our customers who looked to us, and the president of this company, a $250 billion organization, turned to us and said, we need you guys to ensure our supply chain preservation, to truly ensure that we can continue to produce during this pandemic. And they rolled us out to 53 sites around the world, almost all of their sites on planet Earth. And we did all this, by the way, from home in New Jersey, because New Jersey went through a pretty rough COVID scare. I don't want to call it scare, just
reality,
terrible reality. And the fact that we didn't just work on COVID this year, but that we made sure that these supply chains stayed open, and that they were able to collaborate effectively, execute effectively, and to do so at scale at a global level, I would probably say is one of our other really proud moments. And so this year has been very challenging, because, as you can imagine, being a CEO of a tech company, and then everyone goes home, managing everyone and getting everyone to fight when you have the backdrop in New Jersey of really a really brutal period, where we had people who got sick, we had family members who passed away. It was a terrible, terrible moment at a personal level for my team, and they still fought. They fought really hard, and through that fighting, we ensured that really important things were able to happen this year beyond all of the remarkable growth. And of course, that led to financial success. We've raised 2 rounds of capital this year from Insight Partners, who's the 3rd best VC out there. One of the best out there.
I'm sure they're wondering what other 2 you have in mind.
What's that?
I'm sure they're wondering what other 2 you have.
Yeah, exactly. I'm going to get an email about this afterwards. They're going to say, Angelo.
We'll say one of the best at a top tier VC.
One of the best, yeah. But Insight truly is one of the best. And to do 2 rounds with them this year and to grow at the rate we've grown. The team now in early 21 will be 5 times the size. Again, we've been managing a lot of this from home. And so it's just been a remarkable year all around. And, I hope the momentum continues, but I really hope that we just get out of this. And I hope our customers nail this, because, when they nail this, and we have one small partner, right? I'm not going to take credit and say that we were the ones that, solved this for humanity. I'm not that narcissistic. But we will have one small piece and a hand in this. And just as a case in point, we had one customer who got a batch of COVID vaccine out the door in 12 days. And just to help the viewers understand, normally this takes 90 days to get a batch out the door, and they did it in 12. And it's not all because of Apprentice. My gosh, again, I'm not going to take credit for it. But they did say that without Apprentice, it wouldn't have been possible, period. And so the fact that we had, that level of impact for actual COVID vaccine clinical trial candidates go out the door, it's just remarkable this year. So it was a wild turn of events since I saw you last in February. I think it was February or March.
So yeah,
pretty wild turn of events here.
It's really incredible. I mean, I have so many questions. I wonder if you have a little bit of an inside scoop on the vaccine process. Any words of hope?
Absolutely. I'm glad you asked the question, because I've been waiting to say this and scream it at the top of my lungs, which is, there is no way at all that one of our customers, or frankly, any company in this space, will release a vaccine that's not safe. And I want to be very clear about this, which is, political pressure aside, they're not doing this because of political pressure. They're doing this because they are incredibly invested in the health and safety of humanity. 8 billion people on planet Earth. Our future goes through their product. And they're doing this, and they're working unbelievable hours. I mean, the teams that I talk to working 7 days a week, 14 hours a day. They are killing themselves to race something to market for all of us. And, we are working very closely with them. And my confidence in this vaccine, I will literally be the first one online. I won't be the first one online because I'm not, in a population that needs it first. But, it is
first willing.
Yeah, willing participant first in line in order to receive it, because there's no way that these guys are going to release something that's not safe. Do you know what that's like to release a vaccine and then it impacts 8 billion people, and no one would ever do that, right? Just from a common sense level. But beyond the common
sense. Just to play devil's advocate, though, there's trillions of dollars at stake here. And I don't think any company or any individual around this has any malevolent intent, but there is a lot of money at stake.
Absolutely. But I think the piece that people miss is that it's also unbelievably expensive, where the margins on this are not like a cancer drug, right? Or cancer drug margins are pretty big. You could drive a Mack truck through some of those margins, right? Margins on vaccines are terrible. Like, they really are. And so, yeah, it'll be a great top line number. And yes, there is massive dollars at stake, and pride. There's obviously, I'm not going to discount the fact that there is pride involved in all of this. But, vaccines are not as profitable as people think they are. And especially when they're buying it from the government, those margins are pretty tight. And so, it's one of those things where, yes, even though the blockbuster number is big, and it is big, there's no other way to put it, the reality economically for the company, it is not as stellar as one would potentially think, even though the top level number is very high. And so there is motivation, of course, financially to get this out the door. But based on the folks that we're working with, the actual ones that are touching this drug product, that are making this drug product, the people that are really at the end of the day responsible for the production and safety of that drug product, those folks that we have been shoulder to shoulder with, I have unbelievable confidence in them producing something that is not just effective, but safe for humanity. But with that said, the biggest challenge by far is scale. Because yes, something will be approved, and we're convinced something is going to be approved this year in 2020. But how the heck are they going to produce at the scale that humanity needs, right? Because You have to think about this. Every bioreactor on planet Earth was already scheduled out for the next 3 years, right? Pharma is not something that there's like agile development, right? Like, it doesn't exist in our world, right?
Right.
All of this stuff has been scheduled for a really long time. And they can't just overnight build a brand new facility. These facilities take 5 to 10 years at some time to build. So what do you do when every single tank out there is at max capacity? How do you then find capacity for 8 billion people? And so that challenge, that scale is very, very difficult. And not just the scale of just capacity, right? Capacity is obviously a limiting factor, but how do you then scale up a drug at the rate they need to scale up? And to do that when, there's just so many different constraints right now on those teams. Those teams can't travel, they can't collaborate, they can't, shift off their data. There's so many different challenges, and what we do and what we're working on is very much incorporated into all of that. And why?
How confident are you that they? First of all, how confident are you that whichever company creates the vaccine will be using Apprentice?
100% confidence.
100%.
Yeah.
Okay.
Yeah. And
so
I just want to be clear. It'd be used in some way. I'm not going to overplay this one either and say every company is using our software, but they're using it either directly or through their contract manufacturer. Again, capacity is so tight in this world, they may have to work with a third party to find capacity to scale. And at this stage, there is 100% confidence that whoever wins will be using our software.
So obviously you feel 100% confident in the result of the vaccine itself. And I'm just, again, playing devil's advocate, thinking about some of the things that people, on everyone's mind, where you have a unique insight right now. Speed increases errors, right? And your software, it does by nature increase speed, and seems like does so with error minimization or elimination in mind. Mm-hmm. Again, with the stakes being so high here, how can you be so confident that something that, and I don't know, maybe you do know the offhand, normally a vaccine takes X amount of time to produce. Now it's going to take something short, right? So now we're in the time period of months.
Yeah.
So that seems inherently, there are significant risks in the process. So I'd love your take on what gives you so much confidence in the process, or in the result, really.
Yeah, and that's really where we sit at this unique intersection between all of these challenges, right? Because speed is obviously unbelievably important in 2020, right? And into 2021, of course, because the faster we get there, the faster that, again, it's not just about health and safety. It's economically, it's well-being. It's so many different things that, this can unlock. Because I think ultimately, governments have decided that, the only way that we'll go back to normal is with a vaccine. The lockdowns are only so effective, and we can only spread or dampen the curve so much, with all of this. And so the only viable way out of it is via a vaccine or therapeutic. And so specifically why I have confidence is within the actual process, there are very important components and process data that are being tracked. These are called critical process parameters and critical quality attributes. These numbers are the most important metrics to the safety, reliability, and efficacy of that batch. And those values we have extreme confidence in based on how tight those metrics are being managed and how they're being managed and how they can enforce data integrity into those numbers. Because if the number it doesn't have data integrity and it's a little bit funged, right? Like, you can't have confidence in a number if the source is corrupt. But we have confidence in the source, and we have confidence in the fact that how those metrics are being managed and maintained, that it actually can deliver that batch, even with the timelines and restrictions and you name it, on everything placed on that team that's executing this. If those are managed correctly and that tolerance around those critical process components are actually safe, then we know that they can produce this confidently with the right safety in mind. So it's all about the data integrity and specific components related to it.
It's fascinating. How concerned are you that when the pandemic is over, apprentices' growth slows?
We'll definitely have some slowing. I can't imagine we're going to continue to grow close to 20x every year. Right? I don't know if I could do that. Right?
Yeah.
Well, maybe I can. We'll see. But what we see happening is that this is kind of a snowball effect, where COVID was the thing that we're focused on right now, and we're racing our customers towards. And again, not just COVID, but ensuring all of the other drugs out there are produced safely and to do so at scale. What we see, though, coming out of COVID is that the world's changed. The world has changed, and companies are being forced to adopt new technology, where it is no longer a luxury anymore to just say, well, we'll start to think about our digital transformation journey in the future. That's over. Game over. And these companies will be forced now, and are being forced to make these changes and make them now based on the challenges that they're currently experiencing. And so when all of that, when you take all of that into account, we believe then there will be additional pretty strong growth opportunities from the rest of this industry to continue this transformation, because COVID is just one little piece of this puzzle, right? It's one little piece, and there's a much bigger pie that still needs to go through this transformation. And we believe we can be at the heart of that transformation, and point to all the success that we've had, of course, over these last 10 months, in particular, to then use that as an opportunity to continue to grow at the rate that we want to grow, and that I believe that we can grow at.
Yeah, it's awesome. For people who are watching, especially those who are members of the TechUnited New Jersey community, how can they help you?
So we are hiring quite a bit right now. And if there are folks who are interested in working on not just a high impact, tech right now that is clearly very high impact, but also a pretty exciting one. We do work on augmented reality, AI, machine learning, computer vision, some really cool stuff with by far all the most modern tech stack in mind. We need help. we need help. We need help now. And we are growing our team, and we are looking for pretty much every role you can find, from engineering to QA to product to design to sales to customer success to support to marketing to communication to kind of everything in between. And so, if there are folks in the TechUnited community here in New Jersey that want to be part of this story, that want to have a hand in having an impact here in New Jersey, and to do so here in New Jersey, I want to be clear about this too. We're doing it here in New Jersey, a state that, I believe is really just remarkable and ready for this next wave of massive tech growth. And to be part of that crest that's forming, we would love to have you join our team. And so if there are folks out there that are interested or know somebody that could be interested, please do definitely reach out to us, because we're growing by leaps and bounds. And, we love some folks here at home to help us with that journey.
Awesome. I really appreciate that. I have so many more questions. I hope we can do a follow-up. Usually we spend more time on the entrepreneurial journey. In this case, I think the topic of the pandemic is so important that I'm glad we had a chance to spend more time there. I hope we could do a part 2 and maybe even bring in at the time, perhaps the CEO of the pharmaceutical that solves the problem, to talk about how we got there. Well, that person might be in high demand, but we'll see.
Sounds good.
Really appreciate everything that you're doing here. Great to be with you again, even if it's virtual this time. Anybody who's watching, check out apprentice.io if you're looking for a job, want to help out, want to just encourage them along. Really, really great work, and glad it's happening here in our backyard, which is awesome, because I'm with you, right? There is this crest forming, and I think it's founders like you that are making this a lot of fun for people like me to be part of it. So really appreciate that. Hopefully we'll see you soon. But that's the end of the show. Thanks a lot for joining us. Usually, if you were with us at Propelify at all, our go-to now is to end with the high five, the virtual high five. So on the count of 3, high five the camera. 1, 2, 3, boom. I know it's not as much fun, but it's all we got. Angelo Straquitano, apprentice.io. Thanks a lot, man.
Thanks, Aaron. Really appreciate it.
Thank you.